extreme pleasure to welcome our very acclaimed doctor, Dr. Garima Sharma, who is present with us to answer some of the very interesting questions regarding our today's topic, which is hormonal imbalance and infertility. So, doctor, before we jump into the further questions, would you please like to introduce yourself with our viewers?
Thank you. At the outset, I would like to thank Narikaa for inviting me here. Well, I'm Dr.Garima and I practice as a senior fertility consultant at Apollo Fertility in Mumbai, and I'm also the medical director for Eva Care Fertility Center in Mumbai. So, when I got a call from one of the members from Team Narikaa, they told me to speak something related to fertility, and that reminds me of my memories of when I started exploring my knowledge into the field of science related to female health. And it is during my post-graduation days from KEM Hospital in Mumbai, which is a very reputed hospital in our country, when I realized that female infertility and hormonal imbalance is something which is very, very common nowadays. But unfortunately, the bridge between the healthcare system and the women and the girls is so wide that the time taken to reach to a healthcare center is increased a lot, and therefore that's when I realized that it is my passion, that I want to educate the girls that if we timely acknowledge our problems related to hormonal imbalance, seek help from the healthcare professionals, we can easily achieve the targets that we are looking forward to. And then to explore this passion, I went to a Sargangana Hospital, which is another very reputed institute in New Delhi, to pursue my super speciality in the field of reproductive health and hormonal imbalance, improving the women health care.
All right, doctor. Thank you. That was really impressive to hear about. So, doctor, what was that moment in your life when you decided to become a doctor?
I think I wanted to become a doctor when I was in the womb of my mom. So I come from a family of doctors, and my mother, also being a gynecologist, I've seen her all these years serving towards the improvement in women health and to eradicate the myths that it is a disease, fertility is a disease, and it is all about improving women health. So I think from the childhood I was very, very particular and sure that I wanted to be doctor and pursue in gynecology and super specialize in fertility.
All right, doctor. Thank you for your information on this. So now, doctor, we'll move into our further questions, out of which my very first question is, what are hormones?
Okay, so hormones are a very integral part of our body. Now there are a lot of hormones, and the most important role of these hormones are that they ensure that our important bodily systems are in their place. Any hormone which goes off the track can impact our bodily parameter and therefore can result into the different signs and symptoms which we will discuss.
And doctor, moving to our next question, that is, what according to you is infertility?
So, as the name suggests, it is the difficulty in getting pregnant or inability to conceive after a couple has been trying to have a regular unprotected intercourse for more than 12 months, or earlier, that is for 6 months in women who is more than 25 years with or without menstrual problems.
All right, doctor. Doctor, what is the hormonal disbalance?
So, hormonal disbalance, or in our scientific terminology, we call it as hormonal imbalance, as the name suggests, that is the sync between the different hormones is going on a toss. So, the hormones can be very high in their levels, or they can reduce in the levels, or there can be an altered ratio in certain hormones. Now, as I said earlier, also, these hormones are very, very important to ensure regulating our body systems, and hormonal imbalance is one very leading cause of female infertility.
All right, doctor, that was really informative. Doctor, what conditions are caused by hormonal imbalances?
So, the most common, if I'm talking about female health and the impact of hormonal imbalance, the most common hormonal imbalance that we talk about is the polycystic ovarian syndrome, or the PCOS. which impacts your periods as well as the fertility. And the other conditions which are associated with hormonal imbalance are your thyroid hormones, which can be on either a very high end or a low end. The other could be prolactin, again a very high or low end can impact your periods and fertility. Insulin resistance, which can culminate into infertility, menstrual problems, or diabetes, and cortisol hormone related issues, which again come with their own set of problems.
All right, doctor. Doctor, what causes infertility in women?
So, there are a lot of causes of infertility in women, and the leading cause of infertility in women is hormonal imbalance, which I talked about earlier, and PCOS is one very big factor which contributes to female infertility. If I look into the other parameters which impact female fertility, age, that is an advancing age more than 35, or blocked fallopian tubes, or conditions like endometriosis, conditions impacting the uterus like the fibroids, adenomyosis, or adhesions within the uterus, all of these conditions can cause infertility in women.
Doctor, my next question to you is, how does hormone imbalance affect fertility in women?
Okay, a very interesting question. So, a hormonal imbalance is largely about the loss of sync in different hormones which regulate the periods. Now, every month when a woman gets her periods, these hormones they act in a proper way so as to ensure that there is one egg which grows at a definitive period and it ovulates. Hormonal imbalance impacts this stage wherein either the egg growth does not happen, the ovulation does not happen, or the ovulation gets delayed. And as a result of which, this woman will experience difficulties in terms of irregular periods and infertility.
Okay, doctor, thank you. Doctor, which hormones have an impact on fertility?
So, hormones which regulate your periods are going to automatically impact your fertility, and the most common ones are a loss of sync in hormones like FSH, which is follicle stimulating hormone, LH, which is luteinizing hormone, estradiol, and progesterone. All these four hormones are required to ensure a timely ovulation. Other hormones which can lead to infertility in women are thyroid, prolactin, and insulin. Any levels which are either too high or too low are going to impact the fertility.
Thank you, doctor. That was really informative to know. Doctor, what are the common causes of hormonal imbalance that affect ovulation?
So, polycystic ovarian syndrome or PCOS is the leading cause of hormonal imbalance impacting the fertility. Hyper or hypo, that is too high or too low thyroid levels. Insulin resistance, hyper or hypoprolactinemia, and increased or very low levels of testosterone. These are the different causes of hormonal imbalance in women which impact fertility.
Okay, doctor. Doctor, my next question to you is, what are the symptoms of hormonal imbalance?
So, depending on which hormone goes on a toss, the symptoms will be variable. If primarily your hormones like FSH, LH, estradiol, basically if you are suffering from a PCOS, then irregular periods is the first symptom that a girl or a woman notices in her life, periods. The irregular periods can be either too short periods, too long periods, very heavy bleeding, or very scanty bleeding. If it is also PCOS along with some other hormonal imbalance, then difficulty to conceive in itself is another symptom. PCOS will also have symptoms like acne, that is skin breakouts or pimples, increased hair growth along the entire body, thinning of scalp hair, and then suddenly you will also notice a weight gain or a weight loss which has been there for a very short span of time. In case you are suffering from thyroid hormone, then apart from these symptoms, you might also experience symptoms of extreme irritability, tremors in the hand, sudden weight loss or sudden weight gain, or diarrhea, constipation. So these are also the symptoms which are related to thyroid hormone imbalance.
Now it's time for a short break, and we will be right back after this quick break. Welcome back to the Narikaa Talkshow. Now moving into our next questions that are, Doctor, can hormonal imbalance causes weight gain?
Yes, now it is very well known. In fact, sudden weight gain, wherein you see that within 3 months the size of your clothes has changed. The moment you see that, it is a high time that you seek the help of a doctor, because hormonal imbalance is one of, or that too, a very sudden hormonal imbalance is a leading cause of weight gain in the women as well as in men.
Okay, doctor. Doctor, my next question to you is, can hormonal imbalance also causes anxiety?
So it is now scientifically proven that hormonal imbalances is a reason for anxiety, and if not treated in time can even lead to depression in certain cases. And the most common conditions which we see are related to hormonal imbalance and anxiety are PCOS, imbalance in thyroid hormones and cortisol.
Okay, doctor. Alright. Doctor, what are the signs of hormonal imbalances that affect fertility?
So the very first thing, if you are facing a difficulty in achieving pregnancy after, as I said earlier, trying for pregnancy for 12 months, or in case you are 35 and above and you have been trying for a pregnancy for 6 months, along with any of the symptoms that I'm going to now mention, then that is the reason that could attribute to a hormonal cause of infertility. So if you have disturbances in your periods, which could be too short cycles, that is periods happening at less than 21 days, or too long cycles, that is periods happening at more than 35 days, too heavy a flow or too less a flow, along with certain skin changes that you experience, you see skin breakouts, especially around the time of your periods. Suddenly there is a lot of thinning and hair fall, and your frequency of threading or waxing has suddenly increased. There is a weight gain or weight loss which has happened over a very short period of time. All these factors makes us think towards hormonal cause as one of the factors impacting your fertility.
Doctor, does age impact a woman's fertility?
Age after the hormonal imbalance is another biggest determinant of a female infertility. As in how you age, so generally we say more than 35, however it could be plus minus 2 years also. The egg forming capacity reduces in terms of quantity and quality, and all these things can lead to infertility, abnormalities which are mainly the genetic abnormalities in the baby, and even miscarriages.
Okay, doctor. Doctor, also does age impact a man's fertility?
To some extent, yes. But however, the magnitude of impact of age on fertility in men is quite less as compared to that seen in women. Generally, post 40, men can show certain changes in the sperm number, the sperm motility, and sperm morphology, which can be attributed to both the age and the lifestyle changes.
Okay, doctor. Doctor, when to have a hormone levels checked?
So certain hormones like your FSH, LH, estradiol and progesterone, these are period specific hormones. So your doctor will tell you to test them specifically on the second, third or the fourth day of your periods. Other hormones like an AMH, your thyroid, insulin, cortisol or prolactin hormones are period non-specific and they can be tested at any time of your period cycle. However, hormones like prolactin and cortisol are generally advised to be tested in the early morning sample.
Okay, doctor. Doctor, my next question says that how hormonal imbalances are diagnosed?
So the first thing which comes to us as gynecologists in terms of hormonal imbalance and fertility is PCOS. So there is a very famous criteria which we call as the Rotterdam's criteria to diagnose PCOS. 2 out of the 3 criteria need to be fulfilled for someone to be labeled as PCOS. The first criteria is history of irregular periods, which we talked earlier. Too short, too long, a heavy bleeding or a scanty bleeding are signs and symptoms of irregular periods. The second criteria is that you have higher levels of the androgens or the male hormones, which can be seen either by checking your blood test or the blood hormonal levels for these androgens, or you have signs and symptoms like increased incidence of acne, thinning of your scalp hair, and excessive growth of hair on the other body parts. And the third feature is the ultrasound, which shows large ovaries wherein the ovarian size is more than 10 cc, or you see a lot of small follicles, that is more than 12 follicles in each ovary, which gives us a typically polycystic pattern. Now the other hormones like your thyroid, your cortisol, prolactin, they can be easily diagnosed in case someone comes to us with the symptoms which are suggestive of hormonal imbalance, and then you can do a simple blood test for these hormones to look out for any imbalance.
Doctor, how is infertility and hormonal imbalances are treated?
So my first and foremost thing is, which I said, that there is a huge bridge or huge gap between the symptoms and the arrival to a healthcare system. Infertility in today's day is still a social taboo, and people would resort to home remedies or to the remedies given to them by their neighbors or by their colleagues, and that is when the complications arises. So the key feature of the treatment for both the hormonal imbalance and infertility is early recognition of your symptoms and timely consultation with your doctor. If you are able to do this, then lifestyle modifications play a very big role in treating both the things. When I talk about lifestyle modification, the first thing that we emphasize on is a clean and a balanced eating, wherein a disciplined, timely eating, all the nutrients focusing on your protein, carbohydrates, micronutrients, vitamins and fats, avoiding the processed and outside food, avoiding the aerated drinks, avoiding any kind of a substance abuse like the alcohol, smoking is going to play an important role in treating your hormonal imbalance. The second component of this lifestyle modification is exercise, wherein we talk about, even if you are able to give 30 minutes to yourself 5 days a week, any format of the exercise that you like, be it running, jogging, yoga, dancing, anything that gives you a fitness is something which is also going to help. And the third integral part is reducing your mental stress. All of us live in an environment wherein we cannot keep ourselves away from the stress, but small things like meditation, pursuing any hobby, giving yourself the so-called me time for about just 15 minutes in all these 3 things, that's your diet, exercise and ability to manage your mental stress, is a way to reduce all these problems which arise out of hormonal imbalance. However, there are certain set of females who come to our doors at a very late stage, and here we gynecologists will come into, wherein we rope in some medications to ensure that this female grows the egg at the right time, ovulates, and then we guide them for the timely intercourse as per the fertile period. So lifestyle with or without medications is the key to the treatment.
That was really informative to hear, doctor. Now, doctor, moving to our last question of the session, that says, how can a person prevent a hormonal imbalance?
So I think that should have been our first question. Prevention is better than the treatment. So as I said earlier, the earlier you catch the train, the better are the results. So we focus a lot on educating adolescent girls about the need of a healthy lifestyle, because an unhealthy lifestyle nowadays we have seen started arising in these teenager girls and adolescent girls, and which eventually, once ignored, culminates into hormonal imbalance. So as we talked earlier about clean eating, importance of exercise, and acknowledging your mental stress, Also, if you have any kind of symptoms which are related to hormonal imbalance, be it your irregular periods, be it your sudden weight gain, weight loss, if you are finding a lot of anxiety, irritability, depression, if you are in the age group where you are trying to be pregnant and not able to conceive, please knock the doors of the healthcare professionals and seek the appropriate advice.
Okay, doctor, thank you. And doctor, thank you for your information and views on it. I hope the session was extremely beneficial and informative for our viewers as well. So now, doctor, before we leave, is there anything else you would like to share with our viewers?
So I would always like to say, stay healthy, focus on yourself. You are your own priority, so you're responsible for your health. Thank you.
Thank you, doctor. And doctor, well, that was a great response, and it means a lot to us that you took out some time out of your busy schedule for this interview. And we are so glad to have you on our Narikaa Talk show. So now we will meet you in our next session with another exciting topic. Till then, to all our lovely viewers, stay happy, stay healthy, and stay safe. Thank you.